Hello, everyone. Good evening. So, recently we've posted content around fertility and low AMH, and we've got some overwhelming response on it. And I sensed a lot of tension around it. And that's the reason we thought of doing a live on fertility and low AMH. And because there's a lot of tension, I wanted to clarify a lot of things. So if you have been told that you have low AMH and your biological clock is ticking, I want you to pause and breathe. Low AMH does not mean that you cannot conceive naturally. This is what I wanted to tell. I tell everyone who's been talking to me over the call after getting in touch with us after seeing that reel, and it became important for me to highlight a lot of things. So stay with me till the end. I am going to answer most of the questions about supplementation in AMH, or how to improve the sperm quality, and why do you have scanty periods, and what your lab results actually talk about your fertility status. So we worked with a lot of women who have low AMH, and today they've either conceived naturally, or they're blessed with healthy babies, or they've just improved their parameters. And that's the reason I've taken this opportunity to come here and talk. For those who are new here, I am Niharika Budwani. I am medical nutritionist and a co-founder at Health Hatch. And we at Health Hatch deal with a lot of women and help them in terms of managing their hormones, their thyroid levels, fertility, PCOS, etc. And here we don't believe in just random supplements or crash diets or shortcuts or quick fixes. What we really believe is in looking at your lab results. We look at that, we look at your routine, your health goals, and then prescribe a structured nutrition program. So that you see the results that you actually want to, and so that these results are even sustainable. So coming back, AMH is not just ovarian issue, it's a metabolic issue. AMH corresponds to low ovarian reserves, or that we have low or less number of eggs, which can be influenced by a lot of reasons, that is insulin resistance, hormonal imbalance, thyroid function, or even micronutrient deficiencies. But AMH does not directly tell us about the egg quality, and it also does not definitely tell us about natural conception. So it's not a marker that you should actually rely on. It's the entire fertility panel that you should actually look into. And whoever I've spoken to in last couple of days, I've actually told them, I've asked them about their reports, and there are so many positive sides to this. So I don't think that we should just look at AMH, and today we are going to talk about that. So the AMH means definitely fewer eggs, but it does not mean that the quality is not good, and it all depends on chronic stress levels, insulin resistance, your thyroid function, vitamin deficiencies. And when we correct all these things, we've seen a significant difference in not just the AMH level, but also the overall fertility markers. So there was a client who had come to us with an AMH of 0.7, and she had been told by the doctor that she has to go in for IVF. All the natural windows are closed for her. We assessed her blood reports, and she had insulin resistance, her vitamin D levels were low, and also she had inflammation. Within 3 months of structured nutrition program, we saw a good jump in her AMH from 0.7, it jumped to 1.53, and her insulin resistance became okay, her cycles became regular. So it's not that if you have low AMH, you just need to rush for pregnancy. What you really need to work on is improving your cycle, to balance your hormones, to improve your blood reports. And then if everything is successful, and if you still feel like you should go in for pregnancy, then definitely you should, if you feel it's an appropriate time. We've had multiple such testimonials. We've also posted recently on our reel how a lot of women have improved their AMH levels, but AMH is not the whole story when you're trying to conceive. What actually matters is that I want to clarify, and what matters is that AMH is just one marker, and we feel that when AMH is low and if we are suggested IVF, we totally feel disheartened, and that's not how it should be. Fertility is never judged basis one marker alone or one number alone. We look at the entire hormonal profile, and so comes other test, that is antral follicular count. Now, antral follicle count tells you the number of follicles. It is usually tested on the second or the third day of your periods, and it usually shows how many follicles are available in that month. Sometimes AMH might be low, but AFC gives us more reassuring picture. There have been a lot of clients who have 4 to 6 follicles matured and they feel good, and then we know that we have to work on the quality of eggs rather than focusing on the number, Then comes FSH. Now this is a very tricky one. FSH is the follicle stimulating hormone, and it is released by brain, and it signals the ovaries to release eggs. So when FSH is on a higher side, it just shows that your brain is overstimulated, sending more signals to ovaries, and ovaries are working harder and harder to produce more eggs, and when you have low AMH but optimal FSH, that means that you still have better chances to conceive. So always check for FSH when you're also checking for AMH. So I usually see we've been having a lot of clients with low AMH but really good FSH with regular cycles, with ovulation happening, and that's where the hope creeps in, and that's where you feel that still the window is open to naturally conceive. And when the AMH is low but the FSH is normal, it just means that your ovarian preserve is declining. Definitely the ovaries are not the ovaries are still responsive, the egg quality should be still supported, and the window of opportunity is good. But when the FSH is on a higher side, it just means that your ovaries are not responding efficiently, the estrogen feedback is reduced, and also the brain is compensating by sending stronger signals. It just means that it requires a little quicker and strategic intervention. So go back, look at your blood work, and then you'll know that your hopes are going to creep in again. Then comes your LH, which is the luteinizing hormone. LH works with FSH to regulate ovulation. So if LH is disproportionately higher than FSH, then we know that there is PCOS or there is some dysfunction in the ovaries, and we need to work on balancing or regularizing these hormones. And then comes your thyroid profile, especially the TSH. So the thyroid plays very important role when it comes to your hormonal cycle. It regularizes, or it's like if the TSH is on a higher side, which is suggestive that your thyroid is not functioning well. So if one hormone is suggestive that things are going weird, it's like a domino effect. You'll start seeing the other hormones not working well either, and that's where we've seen that when thyroid goes unmanaged or it's uncontrolled, there are a lot of issues with the period cycle. The hormonal balance goes for a toss. And so even though your TSH should be less than 4, and you feel that, oh, my lab work says that, my TSH is completely normal, but if you're trying to conceive and you're looking at fertility, then your TSH levels have to be less than 2. And I know that it's like a little confusing because it has to be less than 4 and it's normal, but when you're trying to conceive, it has to be less than 2. Why we emphasize on this number is that we've seen when the TSH is slightly higher than 2, and when you're trying to conceive, it leads to a lot of other issues. One is definitely the ovulation. Second is implant doesn't happen. There are high chances of miscarriages, and that's the reason we want to make sure that your thyroid levels are under control. So this is what we do at Health Hatch. We just don't look at one number and then give you a verdict that, oh, you can conceive or oh, you cannot conceive. It's like the overall profile that we want to look at and we want to understand, and then give you a good structured nutrition program that can help you conceive naturally. And we not only give you like a structured nutrition program, but we also give you supplementation protocol. So someone had asked, what are the supplements that you suggest if someone has low AMH levels? And firstly, I would want to tell that you cannot self-prescribe supplements or any medications based on Instagram reels. We are here to give you suggestions, but if you come to us one-on-one, we understand your lab work, and that's when we tell you what are the supplements you can take. It can be coenzyme Q10 or vitamin D or myoinositol or omega-3. It all depends on your lab work, and if you supplement yourself without looking at your blood reports, then it's just like an unnecessary expense that you've incurred, because it's not going to work. So this is why at Health Hatch we rely on your entire detailed fertility panel before suggesting or prescribing any of the supplements. Someone also asked about sperm health, and sperm health, talking about sperm health, it's very important and honestly not discussed enough, because male fertility also contributes to nearly 50% and of your outcomes, and yet often it's overlooked, and our society is such that we keep pressurizing women. We extensively run tests for women, but usually we don't do much for when it comes to men. And sperm quality is it really influences how the entire pregnancy is going to turn out to, and how the fetus health is going to be turning out to be. So it's very important. And when there is inflammation, the diet is poor, there is alcohol, there is smoking, there's a lot of stress, then it definitely damages the sperm DNA and also reduces the morphology and the motility. So definitely conception is something that becomes challenging when the sperm health is also not all right. So there are certain lab reports and also semen analysis that we look at before prescribing diet. So we have couples on the program, and we help in terms of nutrition and supplementation to improve not only the quantity but also the quality of sperms, that is the morphology, the motility, and the DNA structure. Basically, we want to integrate everything and make sure that the journey of you getting pregnant is really simple and it goes smoothly. So fertility again is a shared responsibility, and when both partners optimize their health, the outcome improves significantly. There are a lot of men also taking responsibility and getting themselves tested. Then comes scanty periods and AMH. This was another question that was asked. A lot of people asked about scanty. So when the ovarian reserves decline, that is when the AMH declines, but if your periods are getting scanty, it can be due to a lot of reasons. It can indicate that the estrogen is on a lower side, that the endometrial lining is a little less, or the ovulation is not happening, or the thyroid is not under control, or if there is chronic stress. So you need to figure out what are the reasons, and because AMH doesn't cause scanty periods per se, it's your entire hormonal profile that we need to look at. If the scanty periods are there, then it's like a warning sign. You need to work on it immediately. If you're trying to conceive, you have to visit a doctor, take the appropriate steps, and understand how many follicles do you have each cycle, and how you can work out a normal pregnancy or a natural one. So because when the cycle improves, automatically the lining or the endometrial lining improves, the ovulation improves, and the blood flow is better. I was just talking to one of my client, and she said scanty periods is quite normal, and it's okay, everybody has it. But just because everybody has it, it does not mean that it's normal. It might be common but not normal, and to work on correcting it is very important at the earlier stage, because usually women wake up when they want to conceive or when they want to have a baby. So even if you want to postpone to your pregnancy or the conception, it's completely your choice. It's a personal choice, but I would say that still work on your lab results and make sure that your markers are normal. Also make sure that your health is optimal, so that when you want to conceive, you don't fall back. There's not a lot of stress coming in, that your body is not in the best health. So I'll just see if there were questions asked. This was all from my end when I want to talk about AMH. Someone asked that can AMH increase? Seriously, yes, it does. Completely depends on why your AMH has come down. So the root cause is what you need to look at. A lot of people who come to us, they have low AMH. It can be because of insulin resistance or thyroid dysfunction. And the moment we correct these root causes, we see that the AMH is improving. There might be hormonal imbalance that we want to work on. Usually with PCOS, we've seen that the AMH goes significantly higher, which is again not a good sign. So when you work on your root cause, you see that there are changes in AMH. Scientifically or theoretically, no, it does not or it should not increase. But we've just posted a reel with testimonials of how clients have actually managed to increase their AMH. It might not be significantly high, but definitely there is some change in their increase in their AMH levels. And this is a positive sign because, a little bit of nutrition, a little bit of lifestyle, a little bit of everything that falls in place and makes you healthy and gives you hope and makes you pregnant. We've had a woman who was with us. She was 40-year-old with PCOS, low AMH, and she still managed to conceive naturally, and she's blessed with a baby boy. So nothing is impossible. It's just that it takes a lot of discipline and consistency from you to make your health in an optimal state and a favorable environment for your baby or for the natural conception to happen. And it's just that you need to work on. So someone has written that my AMH is 1.24. Guide me, what do I do? I am divorcee. So if you have pregnancy, or if you have pregnancy in mind, or if you want to conceive or have kids later, after you find someone, then you can always opt in to freeze your eggs. You can speak to your doctor. That's an option right now available. So when things are better, I would suggest that you work on the quality of your eggs and then go in for that, because you never know when you want to conceive. And at that time, I don't want you to face any challenges where you are not left with any eggs at all. So speak to your doctor and please talk about this option. I'm just going through what are the other questions asked. I was told that AMH cannot be increased in any case. Yes, exactly. Even we thought so until we started seeing that it does increase when we change, their diet and lifestyle. And if there is a structured nutrition program that is customized to what your reports are and what your root cause is for having low AMH. Can you save this video on your page so that, yes, of course, we are going to post this on our page. You can always come back and go through. We've also posted a reel on what you should eat. It's like a post, on what you should eat if in case you're trying to improve the quality of your eggs, or if you're trying to improve the quality of your spouse's sperms. The foods are mentioned in the caption, so you can please go and have a look. We've mentioned a list of foods for both, for uterus health, for egg quality, for overall sperm health, the motility, etc. And so I think this is it. If you are feeling overwhelmed, please know this, that low AMH is an information. It's not a verdict. Fertility does not define or is not, just relying on that number or luck. It's more biologically, and that's the best thing because you can support that through nutrition. If you want us to review your blood reports and tell us where do you stand, please DM us, write fertility and drop your reports, and we will get in touch with you. Also drop your number so that we can call you and explain you. Just DM fertility and our team will get in touch with you. And save this live, share it with someone who needs some hope today, and we'll see you in the DMs. Thank you. Good night, everyone. Bye bye.